All right, good afternoon, everyone, and welcome to our afternoon board workshop of Child Support Services Overview. So before we get started, we're going to do some introductions of everyone around the table and those who are in the room. My name is Rena Moran. I'm Ramsey County Commissioner of District 4. And we're going to go around this way.
Freda, Ramsey County Commissioner, District 1.
Hi, John, Ramsey County Commissioner for District 6.
Trista Martinson, District 3.
Erica Schumacher, Ramsey County Attorney's Office.
Lori Ray is Deputy County Manager for Safety and Justice.
I'm Trish Sculphammer. I'm the Director of Child Support Services in the County Attorney's Office.
Good afternoon, Sharon Choi, County Attorney.
Joanna Berg, County Manager.
Katrina Travers, Assistant Division Director. And for Nylax is Division Director. Threw me off. Division Director, Human Services Legal Division.
Christopher Johnson, Assistant Division Director, Human Services Legal. Patrick Hess, the other Assistant Director, Human Services Legal. Eric Willems, Director of Administration.
Lee Chang, Chief Clerk.
Rich Stevens, Snyder, Office of Safety and Justice.
Jennifer Rourke, Governor Littleton.
Larry Zimmerman, Policy and Planning.
Victoria Reinhardt, Ramsey County Commissioner, District 7.
All right. So today's board workshop is as a part 2 from a workshop that was held in February of this year. At that time, we had a child support overview, and we learned about some of the initiatives that child support is involved in that is a part of the county attorney's office justice transformation efforts. So today's workshop will focus on child support performance measures and budget. Child support is a program that receives 66% of its budget from the federal government, in addition to performance incentives, funding, and levy dollars. So it's a combination of all three. We will also hear about hiring, retention, and staff challenges. So in order to begin, I want to welcome our County Attorney, John Troy, to get us started.
I think we should defer to our new Deputy County Manager first. I think we're gonna kick it off. I think that was the plan.
No, I
Well, was it?
think,
Oh, okay.
we did some planning behind the scenes,
Yeah.
but I think it's fine. I think, thank you for coming
Yeah.
back to do this presentation. We had a lot of questions, a lot of conversations and dialogue at the February board meeting, and so this is just really a follow-up. And so look forward to the
It is,
presentation, yeah.
And we're really looking forward to, because I really appreciate the topics that we're gonna cover today, because I think this is where really I'm hoping for board engagement. So I'll turn it over to Trish Sculphammer, our Child Support Program Director.
All right, thank you. We appreciate the opportunity to be here and continue the board workshop that we started. There were a lot of questions in the first portion, so we didn't get through everything. And that's good, I think, because it's better not to rush through it and instead to come back a second time. So today we're going to talk about, there we go, performance measures, budget, staffing, salary, and hiring. And before I jump into that, I just want to go over a little bit of what we covered last time that we were here. So we did an overview of child support services. And we went over the services that we provide, sort of that at a high level, how things work. We talked about how child support can help families achieve financial stability. It can lift them off of poverty. It can get them out of public assistance programs. But at the same time, we also wanted to acknowledge that sometimes the things that we do in child support to collect or enforce child support can cause harm to families, especially if the person who's supposed to be paying child support has barriers to being able to work and pay in those situations. Some of the things that child support does can cause harm, and we spent a little bit of time talking about that. We've been learning in child support about how to do a whole family approach to child support services, and we continue to focus on that in our learning opportunities when we do conferences and webinars and things like that. So that is one of the things that we're focused on right now. We talked about our strategic initiatives, and as Commissioner Moran mentioned, those initiatives are aligned with the County Attorney's Office Justice Transformation efforts. A couple that we highlighted were some of the partnerships we have, like, for example, with the State Child Support Office. We're working on a grant to help survivors of domestic violence receive safe access to child support. We're partnering with St. Paul and Ramsey County Domestic Abuse Intervention Project. We've been addressing racial disparities in our policy and legislative proposals. Some of those include driver's license suspension, stopping interest, credit bureau reporting, stopping foster care referrals for child support, and forgiving arrears, and then contempt alternatives are just a few of the things that we touched on at our last meeting. And what we want to make sure is that our caseworkers know they have the discretion to use the right tool for the job, that they're trained in how to use that discretion. And then, as we'll get into a little bit later, that they have the time to really work those cases on an individual basis and not rely on the automation that's been built into the child support system for the last, well, 50 years almost, but really the last 30 years or so.
Trish, if I can interrupt
Yes.
you for a second, we have a technical problem and
Okay.
we're frozen. If we could just pause for a second and me and her
Yeah.
team can.
The video pause on the viewer side, so we're just gonna quickly do a quick. That was our owl.
Oh.
Well, okay.
That's kind of cool.
I didn't know we talked. Oh, was she?
I'll minimize this, and then if we hover around here, that little bar
Like,
looks
it's
secure
Raphael.
Okay. Yeah, it might be dangerous to have all these wires in front of you.
Don't move your feet.
Yeah. Don't move. We also talked a little bit about some of the other partnerships we're doing. For example, with the State Child Support Office, we're working towards other grants, hoping to get involved in those as those get approved and get up and running. We partnered with the Father Project for over 20 years. Workforce Solutions, we had a partnership with that we're going to hopefully rejuvenate shortly. And then we've also been active in holding child support office hours at Ujama Place. So those are just some examples. Another one that I just wanted to highlight because I think it's really, really important is our work with an organization called Forms Factory, helping us change some of the documents that we send to case participants using plain language, and making sure that they can understand the documents that they're receiving. We found that that effort has actually increased the responses that we get and shortened the response time. And we translate those documents into Hmong, Karen, Spanish, and Somali. So that's just a recap. So diving into what we want to cover today. These are the 5 federal performance measures that the federal government has put in place under the Social Security Act to measure how child support programs are doing. And each of these performance measures is tied to incentive funding. So the paternity establishment rate compares the number of children who are born out of wedlock in our caseload to the number of children for whom we establish legal parentage. The order establishment number compares the total number of cases in our child support caseload to the number of cases where we establish a child support order. Collections compares the total amount of child support that's owed to total amount of child support that's collected. The arrears collection is a kind of an interesting one. It looks at the total number of cases that have arrears owed, which is arrears is past due support. And then if a payment was received on a case, even if that payment was as low as $1, we get credit for that in our arrears collection. So it's not a percentage of the total amount paid, but the number of cases that receive any payment. And then cost effectiveness is how much we spend compared to how much we collect. Our goal on that one is to be at $5, and Ramsey County is currently at $1.90. So there's room to grow in each of those. You can see what the goal is compared to where we're at. So certainly room for improvement in each of these areas. Ramsey County does not perform really high compared to some of our county partners across the state. Ramsey County has some challenging demographics, as we all know. One of the things that I can highlight is that we have a higher number of public assistance caseloads within our child support case load than other counties do, with just a few exceptions. And what that means is that case was referred to child support because the custodial parent or the parent who's supposed to receive support is receiving some type of public assistance. That could be TANF dollars, childcare assistance, or medical assistance. Those are harder cases to work because oftentimes if the custodial parent is in need of public assistance, the non-custodial parent or the parent who's supposed to pay support is also struggling financially. That's a pretty common thing that we would see. And while I say that Ramsey County is a lower performer across Minnesota counties, Minnesota as a whole is a very high performing state. We rank number 5 in current collections across the country. And if Ramsey County was measured as a state, we would be at number 12. So I highlight that to say that while we may not be doing the best in terms of who we are in the pool with in Minnesota, we're doing pretty well on sort of a nationwide basis. I also want to highlight Minnesota's human performance measurement system. So the previous slide was showing the federal performance measures. Minnesota created a human services performance measure system. I should have put the date in here. I believe it started in 2009. That effort comes from Minnesota statute. The legislature designated that all human services programs in Minnesota should have performance measures that they're held accountable to. And when they don't meet the goals of those performance measures, then they get put on a performance improvement plan. So the performance measures for child support include paternity establishment, order establishment, and current collections. Ramsey County is currently on a performance improvement plan in the area of paternity establishment and order establishment. This is the first year that we've been on a performance improvement plan. All the other years we have met the requirements for continuous improvement in those areas. Our performance improvement plan includes a focus on training, catching up some of the backlog. Like many areas of the county, backlog was sort of out of control during COVID for a lot of different reasons. One of the main reasons was that we were not able to do genetic testing in our paternity cases because we couldn't get people to come into the office because we weren't in the office. And honestly, there was a lot of concern about taking swabs and swabbing the inside of people's cheeks and things like that. So we're working on catch up and we're making progress. We're also focusing on doing case reviews using reports and then accountability, having the supervisors assist with holding people accountable to the performance measures that we have in place. So that performance improvement plan is a 2-year plan, runs through 2024 and 2025. However, if we meet our performance goals at the end of this federal fiscal year, we'll be off the performance improvement plan for the following year in 2026. And I just wanted to highlight that because I think that's important for us to share that we're on a performance improvement plan under the state's human services performance measurement system.
Madam Chair, may I
Yes,
ask a question about
Mrs.
that?
Young.
For the performance improvement plan, if we don't improve, what happens next?
I think what would happen next is we would get more assistance, more guidance from the state on how we can continue to improve. There can be some penalties, but they don't kick in right away and they just continue to work with us. We'd fine tune our performance improvement plan. We would dig deeper into some of the things that we're already doing to try to get where we need to get.
Okay, and then for the backlog catch up, that was with more support staff?
Not necessarily more staff. We are using the same staff that we have. In fact, we're short staffed and I'll get into that in a minute, but it's just doing more targeted case management and having the supervisors really take on caseloads. The supervisors are actually doing some caseload work, providing guidance, offering training. We call them clinics or workshops where we have staff come in and sit down with them, look at their casework, look at their caseloads and make sure they're moving things forward. You're welcome.
Okay. Mhm.
This slide shows Minnesota's Human Services Performance Measurement System in terms of orders established. And what it does is show us a comparison of where Ramsey County is compared to other counties in the region and then the statewide performance. And you can see that we're below that. Our goal is 80%. We missed it by 0.42%. So by less than half a percentage point. We had, for the first time, gotten over 80%. We were really proud of that. And during COVID, we decreased and we're working to get back up where we would like to be. But again, a half a point. So we're pretty confident that we'll be able to meet the requirements of our performance improvement plan and be done with it. If not this year, for sure next year. The other area that I wanted to talk about was paternity establishment, and again, you can see us compared to the region and compared to the statewide average. This particular measure, we missed it by 2.05%, so again, pretty small number overall. And when we consider the fact that we were not able to do genetic testing, which is a major part of paternity establishment throughout most of COVID, it makes sense that we created a backlog during that time, and we do have, like I said, a very targeted performance improvement plan in place that will help us get where we need to be. So I'm confident that we'll be able to do that as well. This next slide shows some of the areas where we receive incentive funding. So this goes back to the federal performance measures and the incentive funding that we get by performing well on those measures. And I wanted to just give a snapshot of where we were pre-COVID. And so that's why these performance measures go from 2006 to 2019. So in paternity established, we had increased by 11%, order establishment by 18%, current collections by 11%, arrears collections by 9%. And we did drop in cost effectiveness pretty significantly by $2.66. But those are pretty substantial improvements that we saw in those years. So we were really working hard to get those numbers up. And we did a great job of that. And I just want to thank all of my caseworkers. I know some of them are listening in on Zoom right now, so I want to thank them for the efforts that they put in and their concern and care for trying to do this well and serve families well. But when COVID hit, that took a toll on us. And so we are trying to recover from that.
Madam Chair,
Yes.
can you just explain what's being measured in cost effectiveness?
Yeah, so cost effectiveness looks at for every dollar that we spend in the child support program, our goal is to collect $5.
Okay.
So right now, for every dollar that we spend in the child support program, we're collecting $1.90.
And in that dollar spent, that you're talking staff time, is that what the dollar, what
It's
dollars are being
It's
spent?
all of our expenditures, so it includes staff, it includes overhead, it includes technology programs that we might pay for, postage, like everything that's allowable under the federal guidelines.
Okay. And then my next follow-up is, we all know COVID set us all back. It's now been 2 years. So what does that backlog really look like now? And are you saying then, maybe paternity, there might be a 4-year-old that we still don't know who the father is because you're backlogged? Or are you taking cases right now, establishing paternity and moving ahead? Like, tell me who's in that backlog.
So it's a variety of people. Oftentimes the backlog cases are parents that aren't necessarily interested in having our services. Those are the public assistance referrals. So when a case is referred to us because a mother usually is receiving public assistance, that mother may not be particularly interested in child support services, so they may not cooperate with us. And they may not return paperwork that we need. They may not show up for their genetic testing appointments or other appointments that we have with them. And they just kind of make it more challenging. That's a lot of what we see in the backlog, because people who are really interested in child support services are usually paying attention to their cases and engaging with us. And those are the cases that are more likely to get served. But we don't necessarily do just, first come, first served. We want to tackle it from both ends. So we have people who are focusing on the new cases that come in the door to make sure those get worked, and then other people who are using reports off of our computer system to tackle some of the cases that have been sitting around longer.
Thanks.
So what happens when a mother does not respond? I had someone contact my office who said, I don't know the father's social security number or other requirements that they may need. And because of that, she could not get child care assistance.
So when a person doesn't cooperate with us, we usually just try to keep working with them to find out why they're not cooperating. And it might be that they have a language barrier, or they're not getting their mail because their housing is unstable. So we would continue to work with them to try to engage and find out why they haven't returned the paperwork that we need. They're not required to know somebody's social security number. So what we ask them to do is provide as much information as they possibly can. And then we have a wide variety of tools at our disposal to do searches on people to figure out what their social security number is, what their date of birth is. We have access to Department of Motor Vehicles records. We interface with social security records. So we have a lot of things that we can do to try to track people's social security down. So if a person didn't have a social security number for their, the father of their child, that would not prevent them from receiving public assistance or from receiving any type of public assistance.
Would it prevent them from having childcare?
It shouldn't,
It shouldn't.
that shouldn't have happened. But if they refuse to fill out the forms,
Mhm.
to the best of their ability, and they don't understand that, then they might not know that they should just send it back,
Mhm.
filled out as completely as they can. We can sanction people, and we reserve that for, cases where we're really just at a dead end. But a sanction from child support, which is telling the public assistance program, this person isn't cooperating with us, and they will then sanction their benefits. And for the MFIP program, that'll be a percent of their child support, or percent of their MFIP grant that is reduced. Unfortunately, for childcare assistance, it takes them completely off the program.
Not
And
till
that's,
the end of their eligibility year,
Pardon me?
not till the end of their eligibility
Right,
year.
yes.
But if they're applying for initial childcare assistance that haven't completed the forms and sent them back, like you said, they can't get approved because they're showing as non-block.
Mm.
But it's
Yes.
not clear that they don't need to fill it, they just need to fill out as much as they can.
I haven't looked at the
Yeah,
forms recently,
know,
but I
I
would
need
think
it.
that it would say that, fill it out to the best of your ability, but we can take a look at that to make sure that people know that.
It's
Mm.
also just a lot of paperwork that you're filling out, so it might be a question that folks have, and that's something where we could send them to through the Health and Wellness Service team of Jamie to their worker who could let them know, like, send in as much as you can,
Yeah,
but that would stop them from getting approved.
it would stop them if they did not do
If they
it,
didn't
didn't-
turn it in.
if they didn't turn it
If
in.
they didn't turn it in. And again, we use that sparingly in Ramsey County. We don't like to do sanctions, because we think it causes more problems than it solves.
Mhm.
So we would only do that in certain situations, and we avoid it as much as possible by just trying to reach out,
Mhm.
return our phone calls, talk to us.
Mhm.
We'll help you understand what your requirements are.
Okay, that's good to hear. Victoria.
You had just, actually, the question I was gonna ask is what you did, so I'm gonna add on to that. So the genetic testing is, um, and there, people are not cooperative because they don't care about child support. I guess I was having trouble with that. Do they have to have it? Is,
Do they
if
have
you're
to have-
getting, if you are applying for, funding, and whatever the services are through the county, do they have to submit to genetic testing? to find
They,
out who the
they
father
may
is?
have to submit to genetic testing if they don't already have, legal paternity established. And that can be done if they were married when the child was born, or if they signed a recognition of parentage at the hospital. But if none of those things happened, then they would need to comply with genetic testing in order for us to establish legal parentage.
And does that just affect the child support, or does that also affect the other services that are outside of the county attorney's?
It just affects the child support in terms of us being able to establish paternity by a legal process and then set a child support order. We can't set a child support order until we have legal parentage established. So we have to do that in those cases, and we do genetic testing because we want to make sure that we have the right person.
Right.
But if they don't want our services, and many times people don't, they may be uncooperative and not return paperwork or not give us names of who they think the father is.
So that's strictly for child support. That
Yes.
is not for any other services that are provided by the county.
But you need to cooperate with child support to get those services. So a lot of parents don't want to do that because either they have an informal arrangement with a non-custodial parent, or there's an abuse situation, they don't want to interact with them, or maybe they don't know them. There's a lot of reasons. You can get a waiver if there is a safety concern. It's part of the process. You still have to complete the paperwork and apply for that and get that approved, and there's kind of rigmarole around that, but there are some families that don't want to go through cooperation with child support because it could do all sorts of things with a tenuous relationship with a co-parent. And yes, because most of the programs have, that's a requirement. And it may or may not be a requirement that the state could change in statute. Some of it might be federally mandated that you have to do it. But some families opt out of public assistance because they don't want to have to cooperate with child support, and they might not either know that they could get a waiver if it's a violence issue, or they might not get approved.
Okay, so what I'm trying to differentiate here then is child support and other public services. So food stamps, all of that stuff. If they don't do the genetic testing, are they not qualified for any of that other stuff?
If they don't cooperate with child support, and by cooperate, so what happens is if a family receives the programs would be MFIP, medical assistance and childcare assistance. Those are the programs. It does not include food stamps, a SNAP program or housing. When they sign up for those types of assistance, a referral is made to child support. So we get those cases by a referral. And then we send them paperwork and they're required to cooperate with us by returning that paperwork, showing up for appointments that we schedule and things like that.
So if somebody doesn't do the genetic testing and doesn't get a waiver, they don't qualify for those other.
They may get,
services.
if it's MFIP, they have their MFIP grant reduced by a percentage each
Okay.
month that they don't cooperate until it goes down to zero. If it's childcare assistance, they won't get childcare assistance at the time that they renew next time, or if they're signing up for the first time, they wouldn't get it. So they can get kicked off those programs, yes.
Okay.
But it's not just the genetic testing piece,
Yeah.
it's much broader than just the genetic testing piece, and I think that's why I was trying to make sure that not all cases need genetic testing.
Oh, okay.
And I think it's important to put on the table too, this is a part of the federal scheme that was
Mhm.
established when they created this federal system that then was administered by the states and the counties,
Yeah.
right? And again, the whole premise of which is the government needs its money back.
Mhm.
Right, and somehow we need to have these requirements so that we can collect back what was paid out for the assistance.
Yeah, and I think it's worth mentioning a couple more things. To go back to the cooperation requirement, I just want to make sure that I mentioned that a person can claim good cause. And what that is to say, I have a reason not to cooperate with child support because I fear that harm may come to me or my child. Our concerns are that maybe that's not explained very well. Financial workers are strapped to with heavy caseloads and time. And so I'm not sure that parents always know that that's an option for them. Or they may not believe that they are gonna meet the criteria because they don't have evidence. Because they may not have made police reports, they may not have an order for protection. So that's another thing. And what we're doing now, right, in Minnesota, like I mentioned earlier, Minnesota was granted was awarded a grant called the SAVES Grant, which stands for Safe Access to Victims or Survivors of Domestic Violence. So what we're looking at in that grant is how can we provide child support services in a way that doesn't bring harm to survivors of domestic violence? And how can we be more mindful of what people's needs are in that area? And that would include providing better information about good cause. One of the things that we think is needed on the good cause part that's in statute is to remove that requirement for evidence. We haven't brought that proposal forward yet, but we're considering doing that in a future legislative session to make it easier for a parent to say, I don't want to cooperate with child support. And at the same time to say that if you want child support, because people certainly can benefit from child support, we want to make sure that we do it in a way that's going to make you safe.
Okay. Go ahead.
All right. So just then a little bit back to budget about federal financial participation. So we have that 66% match. The match is not capped, is however much we spend, as long as it fits within what's laid out as allowable expenses, we're gonna get 66% of that back. However, the incentive pieces of performance, which I'll show in a future slide, we don't get to reinvest that. We don't get 66% back on that as well, which is kind of a minor detail, but I'll show that in a future slide. Actually, the next slide. So this slide shows our total revenues. And you can see the big orange, kind of yellow on this screen line shows the federal financial participation. That's the amount that we get from the federal government to run our child support program. The smaller blue line on the bottom is the incentive funding, and that's the funding that we get based on those performance measures that we talked about earlier. And then the gray line is county levy dollars that round out the revenues that we need to run our program. This slide is meant to just compare real quickly budget to actual. The top two lines, the gray and yellow there, show our expenditures. The gray is budgeted, the yellow is actual, sort of showing that we come in under budget on a lot of our, most years we come in slightly under budget. More recently, that may be a factor of hiring and some of the challenges we've had filling our vacancies in a timely manner. The middle two lines show our revenues. So the blue, the darker blue is our projected revenues, and then the orange is the actual revenues, and you can see where we've had a bump downward in 2020 and then again in 2023 with those revenues. But we're working hard to get those back up where they should be. And then the last two lines on the bottom, the light blue and the green are levy dollars, showing what we use from the levy. We usually hit pretty close to what's projected. This past year, we used more levy dollars than what was projected.
And one thing that I would like to point out as a part of, as we go into the next budgets cycle and we look at these numbers really carefully, what we'll see over the course of the last, I think it even goes before 2018, but it's coming in under budget on the expenses in the program has saved the county attorney's budget. For the most, I mean, last year we were over, but in prior years, a big part of the savings was the actual expenditures in child support being less than what we had budgeted.
Okay, I'm sorry,
Mhm.
I haven't done that in a long time. Commissioner Reinhardt and then Commissioner Zone.
So, you had information earlier about other counties, Hennepin, and I can't remember, I think there was another one. How does Ramsey County compare? On as far as the levy dollars, the percentage of levy dollars?
I don't have that information. I didn't check on that, but I can see if I can find it and get back to you.
Okay, Commissioner Zone.
I'm sorry, County Attorney, can you just repeat that one more time about what you were just describing?
Just at the very top, the two lines, I don't know if it's like it's yellow and it's gray, right? So the gray is what we had budgeted for the expenditures, right? The yellow is the actuals.
Yeah,
And just historically, the child support program has underspent those expenses that then translates into being able to be applied to the law firm side of the budget.
Okay.
Commissioner.
Okay, but the revenue was also below projections, right?
It is, right.
Okay.
So the revenues have come under projections, but it's that those expenses though are I think have been greater is what my point is.
Okay.
Yeah.
And I just want to comment too, the tricky thing about revenues is, of course, some of it is based on how we perform that incentive funding, which can bump that revenue number up. And that's where we've seen a big decrease. But also just to back up to this other slide, that bigger orange block is that federal financial participation, which basically says the more we spend, the more we get from the federal government. So it's kind of like walking a fine line between making sure that we're not leaving money sitting on the table in terms of what the federal government can provide us, but still trying to be cost effective and still trying to make sure that we're working hard to do better on those incentive funding measures. Yeah, and we do have a lot of vacancies, and I'll be talking about that in future slides. So when we leave vacant positions open for a long time, then we're not spending that money, obviously, and that's going to impact that federal financial participation.
Commissioner.
So in the incentive side of things, the only time the county attorney's office gets involved in this is if the child support has either directed directly through the divorce or whatever, it's court order that it come through the county attorney's office, or someone chooses to have it done through the county attorney's office. Is that correct?
The cases come to us either because of a public assistance referral or one of the parents signs up for child support services.
Okay,
The court doesn't mandate people to the child
Oh, they
support
don't.
program.
okay,
The court orders can mandate that we collect child support through income withholding. But if they don't sign up for child support services, then it doesn't happen. We don't have anything that automatically pulls them into the child support program. So it's either those public assistance referrals or people signing up for services.
Okay, so, okay, I'm going way back in time. I remember going to the county attorney's office because I wasn't getting my child support. But we are talking in the, what, 80s. So, but I remember going in and it was very difficult actually to walk into the county attorney's office and say, I need help because I'm not getting my child support. And I was told at the time that it had to be at least 30 days, which was logical. And that if my ex even paid $1, that I didn't qualify for any assistance of any kind.
So things have changed, pretty
Good.
significantly since then.
Good.
So the vast majority of child support that we collect, and I had a slide on this last time I was here, but I don't have it with me today. Over 70% of the child support that we collect comes from income withholding, which is similar to wage garnishment, but it doesn't require the same type of legal process. It only requires a notice to be sent to the employer.
Oh,
There's no delinquency-based, income withholding anymore, which is what you were being, subjected to back in those days,
Okay.
where a person had to be at least 30 days behind before that would kick in. Now it can kick in immediately if somebody comes to us for
Okay.
services.
so the issue of only paying $1 wouldn't come into play.
Well,
because
and
of-
the part about only paying $1, probably, I don't know exactly what they meant by that, or who, who would have said that, but that would be probably using some of the collection tools that we use. So there's different things that we do to collect child support in addition to taking it out of a person's paycheck. We might suspend their driver's license if they're not paying child support. We do tax intercepts, so if they're getting a tax return from either the state or the federal government, we'll intercept those tax returns. We also can use, but seldom do, credit bureau reporting. So if they don't pay their child support on time, they get reported to the credit bureau. And then driver's license suspension is one that was really big too. And there used to be that if they paid anything on the case, we wouldn't be able to suspend their driver's license. That's not true anymore either. They have to be 3 months behind on child support to qualify to have their license suspended. And then the final thing that we would do if somebody's not paying their support, sort of the end of the road, would be a civil contempt of court action, which could require that they spend time in up to 180 days in jail for not paying their child support. And I want to talk about driver's license, credit bureau, and
Good.
Contempt a little bit more, because I think it's really important to recognize that although those are things that in the past have happened with some level of automation, we don't do that way anymore. We have a new policy in child support in Ramsey County that we don't routinely suspend anybody's driver's license. Our caseworkers need to contact both of the parents and learn more about the circumstances about why that parent isn't paying, and also learn more about what the dynamics of that family are. So for example, we don't want to take somebody's driver's license from them for non-payment of child support if they're providing childcare, picking the kids up from school, exercising their parenting time. That doesn't help in the big picture of what those families' needs are. And it puts a lot of focus just on collecting the money when the family as a whole could be harmed by those kinds of things. Credit bureau reporting, we don't do any credit bureau reporting anymore because we think that causes more harm to families. And contempt of court, we would only use in really egregious situations where we know for sure that somebody has the ability to pay and they're actively evading child support services. And we have a pretty robust screening process that we go through before we bring those cases to a contempt action.
A lot's changed, thank goodness.
Yeah, and I just want to highlight too, if I could, that these initiatives, the credit bureau reporting and the driver's license suspension, and there was another one I was thinking, oh, we don't charge interest on arrears anymore either. Those are all legislative proposals that we brought forward to make sure that we were sort of exercising that discretion. Some of it's just as simple as changing the word shall to may, so that we can then look at the specifics of a case and decide what's the best tool to use.
Can you remind me again what the incentive funding is?
Yep, so I'll go back a couple slides and show you that. The incentive funding is based on these performance measures. So we maximize our incentive funding if we do 90%, if we reach 90% on paternity establishment, 80% on order establishment, 80% on current collections, 80% on arrears collections, and then that $5 cost effectiveness goal.
Okay.
And maximizes the right.
maximizes,
I
right?
mean, we're still getting incentive funding.
Yes,
Yeah.
we are still getting incentive funding. There's different levels of how much of
Mm.
the sort of pie you get, depending on how you perform. So if you perform at the top, you're getting the maximum piece of pie. But I think it's important too to know that the pie is a pie. As other states and counties do better, they get their bigger piece of the pie. So you're not only sort of competing with yourself to try to do better, you're also competing with other states and counties.
All right, thank you.
And so it appears that. I guess looking at page 9, at least that's what I've got here. That, Dakota, Hennepin and Ramsey are the only ones that don't maximize it. Or am I looking at the wrong?
This is, yeah, no, that's correct, but that's just for the region. So there are other counties across the state that don't maximize it either. This is just looking at our region.
Okay, just one more follow-up on that. So if this is the standard, or where you can maximize it, are they, I mean, it seems like this is not necessarily something that's terribly achievable. So is it the same way generally across the country?
Yeah, these are federal performance measures, so that all states in the country have the
So do they
same.
not have enough money to provide the incentive, or so that they set the standard that high?
I think it was met, this was created, I'm gonna say, I don't know for sure if it was created when the program was developed, or if it came along a little bit later. I think it came along a little bit later in the 80s, and I think this was Congress's attempt to hold states and counties that provide services accountable to some performance measures by giving us this incentive funding. It's changed over the years, but it's part of the Social Security Act.
Well, and I guess my point is, it seems like, yes, I mean, having performance standards, I think is good, but it appears to me that they've set them so high that most county governments or whoever, most can't meet them, meaning that it's a cost cutting. Cause they don't, like, I mean,
Yeah, I mean, I know that a lot of child support programs struggle to meet these for sure.
Especially with our types of demographics.
Yeah.
Yeah.
In some areas that are more, where the demographics are better, people just generally have more income, they do a better job. And in areas where the demographics are tougher, like Ramsey County, you'll see a worse job, so.
the people that need the most help get less because they didn't do better.
Yeah.
Oh, that makes sense. Hmm.
Any other questions on budget before I move into staffing? All right, so, this slide just is to give you a sort of an idea of how many staff we have. There are 137 full-time equivalent positions in child support. We have, at the top there, the assistant director and the director. We have several planners that we have on staff. We have 10 supervisors, administrative and support. So we have a team, we call them our admin team, that handle some of the administrative and support work. And then we have our lead workers, and those are the ones that provide training. They go to court. They help with complex cases, so people will go to them for assistance. And then our caseworkers is the highest number at 79. Right now, they are technically called support enforcement agents, or you might just say SEAs. And we're in the process of working with HR to get that title changed to child support specialists. We've seen a lot of move away from the word enforcement in child support. We changed our name to Child Support Services several years back. The state office did the same. And most recently, the Federal Office of Child Support took the enforcement out of their name, and they're the Federal Office of Child Support Services as well. And that's meant to make people maybe feel less intimidated by us and less concerned that they're going into an enforcement environment where they fear that they may be arrested or deported or have some other type of really punitive action taken against them. This slide shows a salary comparison. This is the starting salary. And as you can see, Ramsey County is at $22.09 for starting salary for the support enforcement agent. Hennepin County is a little bit lower than us. And then you have Dakota, Washington, and Carver, who are all receiving more. This is a pretty substantial amount of money. I did some calculations on that. So if you were starting out as a as a support enforcement or child support specialist in Ramsey County compared to Carver County. You'd be making $10,000 a year more in Carver County. So that it really is a challenge for us in terms of how competitive we are. Many of our staff over the years have had second jobs. I don't know how many people do, but I know that they routinely have second jobs. Some of our staff, depending on their family size and whether they're a single wage earning adult in that household, would qualify for public assistance programs like housing, childcare assistance, and medical assistance. And I know that some of our staff use those programs. So it's concerning to me that we're not able to be competitive with neighboring counties, and also that some of our staff would qualify for programs that that would give them assistance.
So I'm wondering with like Dakota, Washington and Carver, we have 79 workers. We have 137 full-time workers. What is their staff ratio to ours?
I think I have that with me. So in Ramsey County, our staff to work, our worker to caseload ratio is 153. So if everybody carried a caseload and we didn't have any admin people or support people or lead workers or supervisors, everybody carried a case, the caseload size would be 158. The lowest in the state is Red Lake, which is, would only be 68. The highest in the state, which is interesting, is Stearns County, which would be 408, and they're a high-performing county. They're also a county that's more wealthy than we are. Dakota and Hennepin are the closest neighbors to us that I have data on, and they do have slightly higher caseloads than we do in Ramsey. If, again, that would be if everybody carried a caseload, and you're just looking at total staff, that 137 people to the caseload size.
So how does it compare with the lead workers? The case workers are the ones that are really handling the
Yes.
loads, but the others are part of that process as well. They need to get to them. But is the ratio of leadership to case workers, is that very similar as well, or don't you know?
I think it is pretty similar. I don't have any data on that, but I've talked with some of the people who are in positions similar to mine in those counties and talked about how many staff their supervisors are supervising. Ours right now we have 10 supervisors, so they each have somewhere between 12 and 14 staff on average. I've seen that number as high as 30, and we don't do a very good job when it gets that high. We're not able to provide the coaching and support that people need. And it's especially difficult right now because so many of our staff are new and will continue to be new as we're filling our vacancies. And the folks that come new need a lot of assistance with learning the job. We have some slides on that too. Our training is 6 months, and then even after that 6 months, you're sort of in and out of training for another 6 months. It takes about 2 years to get really competent in the job. Part of that has to do with the antique computer system that we're using that's not intuitive and requires people to memorize codes rather than just, click on things intuitively. If right now I would say, because we're short-staffed in the caseworker, specifically in the caseworker area of the 79 there, we have 19, I think it's actually 20 now vacancies. And I have a slide on that, so I'll just go to that slide. When I wrote this, it was 19, it's now 20. That's 24% vacancies. Historically, we'd have maybe 4 to 6 vacancies at any given time, so 19 is really, really concerning. And what that means is that our caseworkers are carrying caseloads of over 600. And just recently, our supervisors have taken on caseloads to help reduce some of the burden, which then takes away from the time that they would have available to focus on coaching and moving us forward with some of the initiatives that we were interested in doing. We also, I think, are very challenged with those lead workers who provide training and coaching. There's only so many of them right now that have the experience and knowledge to do that, and so they get really spread thin as well. And all of that just leads to more turnover as people are more and more stressed. One of the things that I've heard recently from staff, I might have a slide on this, is that they're feeling really stressed and it's taking a toll on their health. And so we're really trying to do what we can to hire faster. We're going to be working with HR, I know John was in conversation, I don't know if that happened this week, with our partners in HR to see how we can improve the hiring process because it's just taking too long. And another thing I wanted to mention, along the, hiring is that with these numbers, I'll go back to this one, sorry for jumping around, at the 2209. Back in the day, pre-COVID really, when we would offer people a job, they would just accept the job. Yep, take the job. We would get 300 applicants plus for, for those 4 to 6 positions. That number now is down to about 90 applicants. And in the last group that we hired, that we're working to hire now, we had 13 candidates, and every single one of them asked to start higher than the starting salary. Some of them, we were able to get them in higher than the starting salary, but a few we were not. So we were only able to get 8 out of the 13 to accept a position with us because we couldn't meet their salary requirements. This job requires 4 years of experience in a related field or a 4-year degree or a combination. And people who've been out in the working world for 4 years are already making more than $22 an hour. So this is a big concern for us, for sure. And the other thing that happens is when you go into those salary negotiations, you lose a lot of time. So trying to go through 13 people with salary negotiations, the back and forth between HR and us, the back and forth between the candidate and us, it cost us about 3 weeks. And so we may have lost some candidates, not because we couldn't meet their salary, but because they took a different job in that time period. So we have lots of concerns in this area.
Commissioner.
So
Morris.
you just mentioned the requirements for this job. Who sets those requirements?
Those are set by HR, but one of the things that we're talking about when we talk about hiring, improving the hiring process is to change those qualifications, those minimum qualifications, if we can without lowering starting salary. And that's a big if, because when I met with them to talk about this, that's what I was told, that, yep, we'll look at it, but it could mean a reduction in that starting salary, and then I'm not sure that we would be interested in doing that.
What do you need to quantify to be a caseworker?
So it's gonna be either a 4-year degree, we could hire somebody straight out of college with a 4-year degree and no work experience, or it would be 4 years of work experience in a similar job. And what we often think about is sort of, it's related, not necessarily similar, but related is probably a better word. It would be people who've been involved in any type of human services or social services jobs. It would also include financial types of jobs like banking, insurance agencies, people who worked in computer systems before. That might be like if they had been in unemployment at the state office working in unemployment, those kinds of jobs. And we require 4 years of experience, or you can offset that. So if you had 2 years, a 2-year degree, you could have 2 years of experience. So those two things can substitute for each other.
So I'm thinking you have to train anyway,
Yes.
right? And training takes how long?
At least 6 months, and probably off and on. Then after the 6 months, 6 months is the initial training, and then they have ongoing training as they continue to take on more complicated types of work.
So in your experience and expertise, do you think a person needs to have a 4-year degree?
I don't think they need a 4-year degree, no.
Mhm, okay. Question.
I assume that it's not state statute that says we have to lower the salary if we take a degree requirement out.
Mhm.
No, it's not state
Okay,
statute,
so-
but if I may, this is part of how human resources assign salary grades to, and correct me if I misstate this, to positions. It's an accurate statement countywide. It's not certainly as accurate here, but specific more broadly as well. As we are looking to remove degree requirements, except for positions like, nurses and engineers and people who we I think all would reasonably agree we want to have a degree. This is part of the challenge within the HR system, and it's putting in those substitutions. And that ability, as Trish was saying, that you can have the degree or you can have some experience. It doesn't need to be a both and so it's trying to find that balance without reducing the
So
level
if you
of
took it
the
out
position.
altogether,
Yeah.
you wouldn't, that would lower the salary range
Yes,
potentially. I mean, because that sounds like our HR department and we as the county board ultimately
yeah.
determine how much is going to be paid through our processes. I get that. But to just say, well, if you don't require the salary that it's automatically got, or you don't require the degree that it automatically has to be a lower salary, seems wrong to me.
I might suggest that I can ask Dr. Corvini to provide a more complete perspective, from the HR perspective to the board, because it's a fair question. It's coming up
Yeah.
all over the county, lots of places, right? It's all inherent in the system that we have and how we classify systems and what gets points, and there's a lot of complexity behind it in the HR system that's designed to ensure that we equitably rank job classes across a very broad variety of jobs. So there's some inherent complexity in it from an HR perspective, and just taking one component out can be the, kind of cause the rest of it to fall. So,
Okay,
it's a fair question, but it's a complicated question and a better one for the HR director, I think, and I'm happy to follow up on that.
yes, I'm sure it
Yeah.
is. One other question that I have, as far as the, are there, how many people within the 100 and whatever it was are attorneys?
That's not included. This slide here does not include any of the legal staff.
Okay,
So they're under a different sort of division umbrella. So this does not include the legal, lawyers, paralegals, legal secretaries are not included in these numbers.
okay, thank you.
Commissioner Jean.
Has there been consideration of just breaking down some of the work that's done where it's not managed like case by case per caseworker?
Yeah, we have considered that. I mean, we've considered a lot of different things and tried a lot of different things over the years. We've done a lot of process improvement work over the years. One of the things that we think is important is that people, when they call, they get a live person that answers the phone. So we do have a customer service group that always answers the phone live. So we do have some breakdown of that. We have certain specialty areas that do modifications. So when a child support order needs to be changed because a parent loses a job or gets a better job, they focus just on doing those modifications. We have a team that handles all of our intergovernmental cases. And so those are cases where one of the parents lives in another state, and the court orders maybe from another state. So we do have some specialization within that group of caseworkers. And so we try to balance that with making sure also that people can develop a relationship with their caseworker, and their caseworker really understands what's going on in their case and can provide really holistic services that way.
And Madam Chair, I guess I'd just like to say one more thing, because my oldest son was in child support enforcement with Anoka County and then with Cass County. And I can tell, I mean, just from some of the things that he told me and the people that he worked with and the stories that I heard was, it's really a stressful job, because you're dealing with families, generally speaking, that are in total crisis and combative sometimes and all kinds of things. So I think that that's something, when you talked about staff burnout, I mean, that's what happened to him, because he was like, I can't.
And we often talk about it in terms of we're dealing with people's money and their children. And those
Yes.
are probably some of the most important things that people are gonna get maybe triggered about, talking
Yes.
about, you know, that parenting time, custody arrangements, divorces, taking money out of your paycheck. You know, these are really triggering things for people and can be, people can be pretty upset when they call us.
Yes.
And sometimes that's, you know, yelling at us and swearing at us and calling us names. Sometimes
Threatening to kill us.
threatening us. Sometimes it's people.
Sounds like
we get that
county
too.
commissioner job.
Yeah,
no.
and sometimes it's people just crying,
I
you know,
know.
they're telling their story and it's a very sad story and, so we get all of that and it is really stressful. We have a big face-to-face customer service component. We're over at the service center at Metro every day. We have staff over there and we have a lot of time, that we spend on the phones, keeping our phones tapped every day. And it is stressful. It's stressful, to have the client interaction and then add to that stress when the caseloads get really high because of our staffing challenges. It's just too much and we lose people.
And I just wanted to mention that, because when we do workshops, we're looking at numbers, we're looking at dollars. And sometimes that can be overlooked. And I know that, well, probably everywhere in your office, because it's legal action is gonna be pretty stressful, but I know in this particular area.
One other thing, if I could mention too, is that the child support program itself is complex. It's not a simple program to operate. It has pages and books actually of federal regulations and state statute. We have, like, as I mentioned earlier, an antique computer system that people have to learn. And the people that are coming into our program now are starting to be young enough that they were playing with, you know, tablets in their cribs. And so then we bring them onto this mainframe system where you have to memorize codes and stuff. It takes them a long time to learn that. It's really complicated. And then child support is not just one thing. It's a basic support, it's childcare support, it's medical support, who's gonna carry insurance, who's gonna pay for insurance. It's how do you get the collections done? There's all these different components of it that make it a very complex program, and it takes a lot of training and a lot of knowledge, and when people are stressed and burned out, they're not gonna be able to do that part well.
Okay, just a follow-up on that, because Ramsey County, I mean, in our offices, the mainframe was dismantled in 97, I think. So why do they have, you have a mainframe?
It's, if I can, is it still Prism?
Yes.
I was a child support worker. I could probably,
Okay.
I could probably open a case. It's state systems. It's very similar to
state,
what
okay,
LELE talked to us about. These are DHS.
Okay.
systems, correct, and as with
Yes.
Maxis and other systems, it's a lack of legislative funding to
Okay.
upgrade the technology.
It's
Yes.
very similar to Maxis, and we actually got it in 1997. That's how long we've been on the same.
So it's
computer
super
system.
new compared to that.
Yeah, it's like.
Oh, yeah.
I think we're working towards that end, maybe slowly, of trying to update our system, correct?
Yes,
Well, it's a
Well,
state
it's a state system, and so
Right.
it's
But-
money to DHS to update.
Sure, I gotta get
technology.
them to passing it down to us.
There has been some recent, I mean, maybe 2 or 3 years ago, some legislation was, you may remember better,
Mhm.
Commissioner Rand, but there was some legislation passed that put some money aside for a new system, and so there's some work now that's happening. It's probably a long
Mhm.
process. Probably, they told us last time we had an update, not to expect anything for about 5 years, but they're working on it. So that's the update that we
2023,
get.
there was $150 million allocated. At the last, it was AMC last year, I went to a couple of the sessions on systems modernization, and there are a couple of pieces of it that they're considering, trying to be more agile and getting pieces out at a time to simplify the system. The issue is we've relied on systems that we've developed internally, and it means, we can't afford to maintain like infrastructure like that at the state, at what the state pays our IT support staff. And there isn't necessarily an out-of-the-box program that you could buy off the shelf and just implement that works with the way that we've created our programs. So the state has been working, I mean, when I was hired at the state in 2013, one of my jobs was systems modernization. I had started going to meetings in 2013 about, oh, here's the new system. And at one point they were going to be using the same system that Nets or Minsure is in, that was going to be the solution. And I went to early meetings then, and they're like, yeah, we don't have modules. And it was like basically any of the public assistance programs. I think they might have had something for SNAP, and that was it. So it's like, so we're just building it totally from scratch. And then maybe in 2017, 2018, they're like, well, maybe should we actually use that system? And it turns out no. Which I could have told them in 2013 after that first meeting. It sounded silly. But they have a systems modernization team, and they keep working to build. And the problem is you've got multiple processes, because if you can't buy a system off the shelf, the question is, do you build your own system again and get in the same problem? Or do you change your programs to simplify them so you could buy something off the shelf? And then you've got the like chicken or the egg problem, and okay, well, let's change the programs first so that we could buy the system. But if we change the programs, we can't actually implement the changes until we have a new system, because we can't change the current crappy systems to implement those program
Enough.
changes. So good luck to them, but they're trying to get stuff out.
Like
bits and
Mid-Lars,
pieces.
Yeah.
Well, and that's the other piece of it. No one wants the next Minlars. So
Yeah,
how do we
exactly.
pull something out, some pieces out to make it simpler while we transition away from those more complex legacy systems without doing everything all at once, so it crashes like
Yeah.
Minlars.
Well, I do know that they got state dollars and they're working they're get RFPs or whatever out right now to try to minimize that. I know I talked to someone who's doing our Ramsey County child welfare system, right? But there's some conversation about eliminating them to tie into what the state is doing. So that may be a whole nother conversation of what we need to push. But I do believe that AMC needs to make this their #1 priority. because it is having a huge impact in every area that Ramsey County is working in with an old, outdated system that our 21st century people are coming into and saying, this does not work for us. And so they are quietly quitting. They don't have the patience for that. And it's having a huge impact in our production and outcomes of what we need and how we need to serve people. That's causing extensive backlogging in how people have been serviced or not. And so we really got to do a better job of getting in front of this and getting ahead of this and kind of like, we got to have some really critical, conversation with DHS, because I know Ramsey County and 87 counties advocated for some updated services and all the money went to DHS. So we need to make some clear perimeters around DHS and counties and what that looks like for us to do the work that we need to do. There was something else I wanted to say, and I can't remember now. Commissioner.
So
Watson.
I want to move off of technology. We can't control that, unfortunately, at this moment in time. But are your workers in your new space over there? So is that helping with morale a little? You got a great new space, and are your workers actually in the office, or are they still remote 4 days a week?
Most of our workers are remote 4 days a week, but we do have some workers that come in 2, 3, or 4, or even 5 days a week. There's always somebody there. Our supervisors and managers are in 2 to 3 days a week, managers 3 or 4 days a week. So I think the new building is lovely, and I do think that helps with morale. And it's great to see people in the office interacting with each other and catching up. I think that's a positive factor. But also, I think one of the things that we have talked about in one of the recent staff meetings that we had is how many of our people are going to other counties or the state for jobs, partly because they can make more money, but also because in some of those places they can work 100% remotely. So that's the thing too. So even though they may only need to come in 1 day a week under our policy, they may really just prefer to be home and go to some of those jobs like Hennepin County where you don't ever have to go into the office.
I'll be honest, I actually think remote work is the real reason for lower production in most of our areas. And I know that's not popular and unions and staff are gonna be mad, but I'm just gonna say it because I think we keep blaming COVID on poor performance. And the reality is that people get energized when they're around people.
Yeah.
Like we tell ourselves to stay home and remote because it's nice to get my cup of coffee or my kids off the bus. But the reality is everyone's production overall goes down. So I would just challenge that a little bit. And, as I'm looking at these numbers, like we have an excuse for everything that isn't working. Whether it's COVID or we're a poor county, but Hennepin County would have the similar clientele, but their return rate is more than $1 more than us. And so I'm just, I'm a little, what I want to know from you is, do you think we're doing a good job? And if we're not, or where are those areas you say we're on a performance improvement plan, but what exactly does that mean? What are we doing to be better? If it's, you've got, you said you've got 29, I don't know my best, 29 lead workers, but you're like, the lead workers aren't even, you said in your last statement, like they don't have the skills necessarily to do all the training. So what makes them a lead worker? I just wonder, like, in the areas we can control, what can we do better and what are we leaning forward? And like, I'm not feeling any energy. It feels very downbeat. It feels very like there's nothing else we can do. And yet I know personally, like, I didn't get great service when I needed child support help in Ramsey County. And so I got referred to a different county. And that's real. And it's personal. And at the same time, like, there's gotta be a way that we can do something better for our community.
Well, I certainly don't want to come away having this feel like we're very downtrodden in child support because we're super resilient and we have a lot of longtime case workers, people who've been with us for 20, 30 years, sometimes even longer than that, who are really interested in trying to do the best possible job they can. We just need to make sure that we give them the resources to do that. A couple things I wanted to touch on that you mentioned. First, when I say that we don't have enough lead workers that have experience to train, all of our lead workers have experience to train. We don't have enough experienced staff in that other level, the bottom line here.
Caseworker.
that's an inexperienced group. Not as a whole, because there's experienced people in there, but there's been a lot of turnover. I would say, I'm just gonna guess now, because I don't have the data, but I think probably about 50% of the people in those roles now have been with us for less than 5 years. The lead workers, that group of 29, those are people who have to have at least 3 years of experience. They're high performers, they do train, they do coach, they go to court, they handle complex cases. That's an experienced group there, so I just wanted to make sure that I corrected that. And one thing I'll say too about Hennepin County, comparing us to Hennepin County makes the most sense because they're the, we're next closest to them in size and they have similar demographics. We have a higher public assistance caseload in Ramsey County than Hennepin County does. So that's one of the things that we believe affects our performance, but we're not certainly giving up. We're working the PI, the performance improvement plan, in a really positive way. We have a lot of engagement. We have a lot of people who are, really excited about that. And we do have, I think when you look at workers who work from home, I think you see maybe 2 different types, although there's probably all kinds of types. But a lot of our work, you're engaged with a computer system or you're on the phone. You're not necessarily engaging with other people unless you're in a role, a leadership role, or a committee or something like that. You're really engaging with the computer and you're on the phone with people. And some people are super productive in that setting. They sit down, they do their work, they're uninterrupted, they just get an amazing amount of stuff done. And then there are others who need more accountability. And so one of the things that we've been focusing on in the last couple of years is to really increase that accountability and make sure that people are doing what they're supposed to be doing. There's some areas of child support that are a little bit hard to measure, and some areas that are really measurable where we can have really strong performance measures that we hold people accountable to, and others where it's a little bit squishier, I think is the word I would use.
And we can also measure keystrokes and how many cases that you're doing. So this group, the program employees, prior to the pandemic, I think it was like 53% of all of the child support workers. 70% of the workers were working remotely. We had we were like, had this, like back in the day, a very innovative telework program. And so the group is very experienced in managing that because they can look at how many cases are you working on, and the keystrokes, all of those types of things. So the capacity is there to manage that. I don't know that it's necessarily like that's the reason why some of these low productivity is because of the telework. I feel like this group of anybody in the county, they knew how to do it before the pandemic. Yeah.
So we had a telework program starting in 1999. That's how long we've been doing remote work in child support. And our program just before COVID happened, it had about 75% of our people, or 70% of our people working remotely. And it was up to 50% of their time. They were required to come in at least every other day so that they could handle their mail and the paper files. Because we're on paper.
Do we
files.
still do mail? People, I'm sure some people do.
Yes. The caseworkers do mail.
Oh, they do that.
Yeah, so that's
Okay.
one of the things when they come in on their 1 day a week is when they're doing their printing and their mailing.
So thinking about, and I'm going, okay, go ahead.
And I'll just push back on the idea that people aren't those people. That is not the case with introverts. Right. It's the exact opposite. And as someone who's neurodivergent, I get incredibly disrupted when I'm in an office. There was someone I used to work with that would sneeze, and I swear it would take me 5 minutes to recover and get back to work. And it didn't work for me. But different stroke, and there's a lot of folks, and if you think about a job that pays $22 an hour, and then you have to come downtown and get parking and childcare and all those little pieces of it, that can become even more burdensome. And if other counties are offering it, and that is what people want in terms of recruitment retention, that can be an issue.
Yeah.
It's nice that we have the option though, because some people do want to be in a space and need help and want support or want that accountability. And so giving those options is important. And I think important in terms of how we create inclusive and accessible workspaces that meet individual needs.
Thanks, that's good perspective.
I like options too, everything is not for everyone. But I kind of like thinking, what can we do? And so I'm looking back here, all the things that's wrong. It's very stressful. as long as difficult. And we're looking at our salary and what we're paying, I'm guessing everyone, right? Regardless of if your years of experience or your expertise you bring to the table, which seems a little bit unfair to me to do that and cut it off at that one. So maybe something we can do maybe is like, we're looking like everyone is making 2209. We're looking at HR and saying, you know, if you have less experience, then or if we create a process with less experience, maybe they're gonna get paid less. Can we create a process where we say the baseline is 2209?
That is.
And
the
go up
baseline.
from there.
That is the
That is
base, that's
baseline.
the.
Right.
That's the
But-
entry level.
That's-
2209, where that
Not
is. what it
everybody
says,
hires
right?
in at that.
Yeah,
Not
Yeah.
everyone hired
No.
in on
so
that.
it's either that or higher, not less,
Okay, so.
yeah. And then that's union negotiated, just want to remind you.
Yeah.
that-
That's
And
right,
this
so
is a
that-
negotiation.
Maybe we don't have nothing to do with that.
Yep, so.
But I think you're onto something. I mean, I really think if there's one thing that you hear from me, it's just making sure as you enter into this labor negotiation process, please make sure that we are competitive
Mhm.
to those other counties in the state. Because I think the biggest frustration of our staff, you know, a lot of this is just the constant churn of people and then not being able to hire
Mhm.
and not seeing that we're getting the same amount of people hiring and that quality, just all of that. I think it has a lot to do just to make sure that we're competitive.
Mhm.
And if you can give us that, I'm very optimistic about, you know, trying to change some of those numbers and just doing better on that and getting through this performance improvement plan. But I think that's the key, and just anything you can do to, you know, encourage human resources to prioritize competitiveness of, it's not just my office, but I'm sure across the board in the county. In social services elsewhere, just making sure that we're competitive, because right now what I see, and I see it very clearly, is like other counties are upping their game, like in the attorney world, it just like happened like overnight. All of a sudden, everybody's just like upping their salaries. And it's just been really difficult this past year. In 23 was really a struggle on the attorney side of things, and I know it's a struggle for the child support folks. So, and thank you, by the way, for helping us with the encouragement that you gave to HR, because I'm feeling great about the attorneys. I don't think we're gonna lose 16 people like we did last year, right? So now we gotta fix the support enforcement, or the child support workers, as well as other classifications in our office, but then also across the board of the county. Whatever you can do to make us competitive. I want to be the best, right? I know you do too, right? In terms of like how we treat our workers, how we pay our workers. Because at the end of the day, if we look at our budgets, most of our money goes to people, right? We're only as good as our people, right? So please, whatever you can do to make us competitive in getting HR to be flexible and.
So I go back to
very
HR
important.
and say, maybe we need to look at that. Because we have to be
Yeah.
comparable. I also heard that we have higher public assistance programs than Hennepin County, which is our biggest state, so it has to be more than the rest of these other counties too. And so how do we be compatible, competitive with this process here in Ramsey County? We want good workers and have higher workloads, and, you know, we have, who, Carver County? Doing 26 and we're at 22. You know, not that, I don't know who wants to drive to Carver County from the city, but maybe they do. Maybe they do, but we need to create a more competitive process.
I think something that stuck with me at our meeting last week was, in preparing for this today was, you know, children, right, focusing on our children, right, and children who are living in poverty. And everything that comes with growing up in poverty, right, and making sure that money is funneling to them. And so I think that, you know, sometimes we talk about, you know, we focus on numbers and money, and it's just, I think the systems of really trying to get the money into our community is important, and the impact of children who may or may not get the support that they need. Absolutely.
like, a few minutes, go
Could I-
ahead.
Yeah, well, could I just add to that briefly, Commissioner? So just, I think, that we did talk a lot about the technical side and the number, the money and the performance measures and all of that stuff. We're also trying to be really intentional about humanizing the work that we do, having more, encouraging that healthy co-parenting, not creating systems that are, disenfranchising parents from their children. And some of that may affect the numbers, right? Because we don't want this to feel like an automated system that you're just processed through. These have huge impacts in people's lives, their finances, their relationships with it as a family with their children. And so, Trish has really been a leader in our office in the DEI space and continually bringing, given the residents that we serve, being intentional about bringing folks in on all different dynamics of diversity, being really intentional about the human side of this and how are we actually delivering the services to people in our community so that people don't have negative experiences, and we're working with families, not against them in an enforcement capacity. So I just didn't want us to walk away from the table today losing the human element of all of this too, because it's easy to get caught up in the numbers. But Trish has really been on our leadership team, a real leader around DEI, and just continually having conversations with staff and continually troubleshooting, problem solving, how can we make this work for families? We've got a lot, like she said, legislatively, we've done a lot, but we're also trying to think about how can we on the front end offer some maybe restorative mediation options as families come into the service. Like, are there ways that we can set it up, a healthy relationship at the beginning so that we can set these up for families in a way that's less divisive. So just to your point about giving families more options in the system and trying to work with them.
And thank you for reminding us about this human piece of this work, right? And I think a commitment that we see in Ramsey County about how do we look at the whole family, right? How do we strengthen individuals, right? And get that buy-in, right? And not be so punitive on the back end. So just thank you for reminding us the humanity of this work. So we have one last page?
Nope, I'm done.
You're done?
I just have one last comment that kind of builds off what Eric was saying. So the child support program, the federal program and the Social Security Act is 50 years old. We're coming up on our 50th year since this was signed into law. And it was originally established to be a welfare reimbursement program. It's not that anymore. It's changed significantly over the years. And I think going back again to that cost effectiveness number that we all looked at, like where we're supposed to bring in $5 for every dollar we spend, that was again built as a reimbursement program. And it's more expensive to do some of the work that Erica was just talking about, where we're engaging community and doing a better job of talking to people on the phone rather than having automation and some of the initiatives that we think are really important. The one performance measure that I really struggle with is that cost effectiveness. It's important to be cost effectiveness, but to get that $5 does seem out of reach. The other ones I think are all really reflective of what we need to be doing well in order to serve families.
So I like your roundup that you usually give at the end of yours. I saw Commissioner Zone do that at the end. I don't have any. So can you give us like 3 things that we can walk away as county commissioners from this piece?
I think the 2 biggest challenges that we're facing right now are our salaries and our hiring process. Those are the 2 things that we want to be really working to solve. So we don't really have a thing that we're bringing to ask of the board today, other than what John mentioned about going into negotiations with that in mind. But I think the biggest takeaway is that we're really challenged right now, but we're resilient, and we're gonna get back where we need to be in terms of being able to retain staff, hire more quickly, and meet our performance expectations.
Hiring, salary, and looking at HR.
And technology.
Technical.
We're gonna keep helping on the tech.
Well, and I think we did ask, there were a few questions around the table here that you didn't have you could look up, and so
Yes.
just making sure that.
I jotted down one, but I don't remember if there was another one. The one that I had was how much of levy contribution is happening in other counties.
Yeah.
I don't remember what the other.
I don't know if
question
there's,
was.
Lead worker compensation.
Can you repeat that?
oh,
Need worker compensation.
Lead workers'
well, I'm looking
compensation.
at the spread of other counties as well.
The percentage,
Yeah.
of levy that goes in, but
Yeah.
we use, yeah.
And at which level, so.
All right, any other questions? And with that, we are adjourned.